Dr. Chana Davis. I'm a geneticist, science communicator, and mom of 3 young kids. And I'm really excited to be chatting with a brand new contributor to Dear Pandemic, Dr. Alexandra Hall. Dr. Hall is a family physician and senior lecturer at the University of Wisconsin Stout. Sorry about that. She recently joined Dear Pandemic's new Reproductive Health Squad to help you get no-nonsense, science-based answers to your questions. So, Alex, would you mind taking a moment to introduce yourself and say a few words about how you landed in our Reproductive Health Squad?
Absolutely. Hello, everyone. I'm super happy to be here. So, as a family doctor, I've spent the last 20 years of my clinical practice providing full scope family practice, but also specializing in sexual and reproductive health and working with college students, particularly. So, there's a lot of sexual and reproductive health there for the past 10 or so years. I also teach college students and have been really passionate about educating people about their bodies and how they work and helping them understand how to make health decisions for themselves. So I've been a huge fan of Dear Pandemic throughout the past several years, and so was really thrilled at the call for folks with interest in reproductive health to join the team. So thrilled to be here.
Awesome. I just realized I don't think I actually said out loud today's topic, which is
Oh,
birth control. It was in the title of the event, so hopefully people know what they're listening to today. We are taking a break from COVID conversations, but so that's going to be the gist of today's conversation, and you'll be seeing more non-COVID topics from us in the coming months. So before we jump in, just to remind you, we don't take questions cold. So this conversation is guided by questions that are coming into our inbox. And so we encourage you to submit questions to the Dear Pandemic website. And I think that's about it for preamble. So there is a link that I'll drop in actually just to get started because it's going to guide the way that we're having this conversation today. So Dr. Hall, you had a post teaming up with a fellow nerdy girl, August Burns, on different options if you don't want to be pregnant. And I liked the way that you laid out plan A, plan B, and plan C. So I thought maybe that would be a good way to do today's conversation. How does that sound?
that sounds great. Excellent. Should we start with Plan A?
Plan A sounds like always a great place to start. So Plan A, as you referred to it, includes birth control and abstinence. So why don't we start with abstinence and see what you have to say about that?
Yeah, I appreciate the opportunity to talk about abstinence because for many people who work in reproductive health, the patients we're seeing are not abstinent. And so sometimes we tend to forget that a lot of people actually are. So in surveys of thousands and thousands of college students across the country, fewer than 50% of them have actually engaged in penile vaginal intercourse in the past 12 months. So a lot of people are choosing abstinence for a variety of reasons. Not getting pregnant might be one of those reasons. And I just want to acknowledge that can and does work for many people. There are lots of ways to show affection. There are lots of ways to be intimate with another person that doesn't involve a risk of pregnancy. So a definite shout out to abstinence. It works for a lot of folks. But I also want to follow that with a caveat that it doesn't work for everyone, and that also most people eventually at some point in their lives are going to become sexually active and perhaps be interested in ways to prevent or avoid a pregnancy. So most of what we're going to talk about today is the options available then to help those folks not get pregnant if they are engaging in sexual activity that carries a risk of pregnancy.
Yeah, well, yeah, no, thank you for that very balanced discussion of, two paths you can go, but maybe you get to the other path later.
Yeah.
So within the world of birth control and pregnancy prevention, there are so many options, and you routinely counsel university students on how to navigate this. So what advice do you have? And for me, the most obvious consideration is effectiveness, but I know there are other factors too. And so, so what are some of the stats on effectiveness, which is something we definitely need to be aware of, and as I'm sure ranges a lot, but also the other factors we should be thinking about.
Absolutely. And I'm just going to preface this with usually a discussion on birth control takes an hour in and of itself when I meet with a patient. So this is going to be a really high level, quick overview and then some resources so that you can get more information. And then, of course, encourage you to talk with your healthcare provider to get further information and things that are personalized for you and your situation. Mm-hmm. So when I meet with patients, the factors I want them to consider when they're looking at birth control are effectiveness, absolutely. And then ease of use. Are they actually going to be able to use it in a way is intended to be used so that it can be effective, and does the method kind of fit with their lifestyle? Potential side effects, because any type of medicine has side effects and they can vary. And so you need to know what you might be signing up for. I often tell people that choosing a birth control method is kind of like buying jeans at the store. You can read the different styles, like curvy or straight or whatever, but then too, you have to try them on to actually see if they work. And sometimes it's the same way with birth control. So potential side effects that you might experience. And then the fourth is any other health goals that you might have that birth control could help you with, be that acne or heavy periods or perimenstrual dysphoric disorder. There are lots of different things that different forms of birth control can be helpful for. So coming back to that number one, effectiveness, it's really important to acknowledge that we have kind of that top tier of effectiveness at preventing pregnancy. And in that category are the sterilization methods, so tubal ligation or getting your tubes tied, as well as vasectomy. And it's really important, I think, for viewers to understand that those are meant to be irreversible. So sometimes we hear, oh, you can get that reversed. It's not made to be easily reversible, and those attempts are often unsuccessful. So we should never imagine that those are anything other than permanent. But also what's really exciting is that in that top tier category of greater than 99% effectiveness, we also have two options now that have become much more prevalent in the last decade or so. And those are IUDs or intrauterine devices, and the implant, which is the little medication impregnated rod that goes in the arm. And I like to call those the get it and forget it methods. You go to the clinic, you get it placed, and then you don't need to do anything. So the ease of use once placed is phenomenal, and there's no forgetting pills or not showing up for your shot on time. And so not only are those methods inherently very highly effective, but everybody is what we would refer to as a perfect user. There's no user error with these methods once they are placed. So the effectiveness is greater than 99% for both IUDs and the implant. Now, of course, getting them placed, there are potential risks and side effects, and you definitely need to read up on those and talk with your healthcare provider. But these are really effective and rapidly reversible methods of contraception. So we're seeing lots more uptake of those nowadays, in part also because insurance companies now have to cover all forms of contraception. So their price used to put them out of reach for a lot of people, but now that health insurance has to cover those because of the Affordable Care Act, we're able to see a lot more uptake. They are also safe for adolescents and people who've never been pregnant before, which is also kind of a change in medical practice from decades ago for those of us who are a bit older and have been around for a while. So implant and IUDs are our most effective, followed closely by the injection or the shot. Depo-Provera is the common brand name. That's an injection every 3 months. If you're good at getting your next shots when you're supposed to, the effectiveness is greater than 99%. What we see in the real world is that oftentimes people forget to go for their next shot or they're late for it. So in the real world, we see 95% effectiveness with that method, again, because there's that component of user error. Similarly, so the next kind of category, kind of coming down in terms of tiers of effectiveness, but still highly effective, would be the hormonal methods that use both an estrogen and a progesterone in them. And they come in 3 different varieties, which are basically just 3 different ways of getting those hormones into your body. So that would include pills, which most people are very familiar with, the vaginal ring, and the patch, right? So just 3 different ways to get the same types of medications into your body. And what we see for those is that, again, perfect use effectiveness is greater than 99%, but most people have trouble using them perfectly. They forget pills. We know on average, people forget 4 to 5 pills per month. And so what we see in the real world, when we look at all users, we see effectiveness of those rates at about 91 to 92%, depending. So I always ask people, are you going to be a perfect user or a typical user? And that can help people, decide, is this really going to work for me, or am I going to be forgetting pills left and right because my schedule is chaotic?
Absolutely.
The last form of birth control I want to give a shout out to is condoms. And so The reason is because they also protect against sexually transmitted infections, and they're the only other form of birth control aside from abstinence that does. So a huge shout out to condoms there. They are often underutilized. If you're a perfect user of condoms, they are 98% effective at preventing pregnancy. And we know this from studies of workers at legal brothels, of which there are some in the United States, who are professionals and they're really good at using condoms. So that's pretty cool. But what we see in real life is that typical use effectiveness in the real world is around 82% for preventing pregnancy with condoms. So not for people who want to take chances, but way better than nothing, that's for sure, and really good at protecting against sexually transmitted infections as well. So that's an added bonus.
That sounds like a lot of great options. My goodness.
So that's the effectiveness piece,
yes.
right? So when we think about the things that you're gonna, the factors you're gonna look at for choosing a form of birth control, the other would be the ease of use and what works for you. And, is this really going to work to have to remember to take a pill every day? Is it really going to work to have a patch on your skin that your partner could see, which is an issue in some circumstances? So ease of use and what works for your lifestyle is important. And then, of course, side effects. And every single thing that we ever prescribe in medicine has potential side effects, and they can vary a lot from person to person. And we're usually really good as clinicians about informing people about the most common side effects, but we're not often as good about informing people about the less common or the rare side effects. So things can always happen that might not be anticipated. Still, overall, hormonal contraceptives and all the methods we're talking about today are highly safe. They're much safer than pregnancy and childbirth thoughts for sure. But when you think about side effects, if it's a device, if it's in your uterus, there's going to be side effects associated with that. If it's in your arm, potential side effects there. And then if it's a method that has hormones in it, which hormones are in it, which type of hormones and what doses are going to be important. And different people will respond differently. I know we had a reader who commented on our initial post about mental health side effects and mood changes with the hormonal IUD. Those are very uncommon, but they do occasionally happen. And they're less common with that method than with pills, patch, or ring because the dose of hormone is lower. But less common and rare doesn't mean it never happens. So we definitely need to think about those things. And then lastly, just to remember the other health goals that you might have. If you have endometriosis or polycystic ovarian syndrome, you might be using a form of birth control to help manage that condition as well.
One question I thought, since I love my diagnostics and my effectiveness data. So what exactly does the number mean? If you get a 99%
that's such a good question.
Or 95%, what does that really mean?
So if we say that a method is 99% effective at preventing pregnancy, that means that over 12 months of use, 1% of people using that method will end up pregnant. So for condoms, when we say typical use is about 82%, that means that over a period of 1 year, it's called the Pearl Index, over a period of about 1 year of people using just condoms for birth control, 18% of them get pregnant by the end of that year. So that's what we're looking at.
Sounds like a lot when you put it that way.
Yeah.
Yeah.
So, and I think it's, the perfect use effectiveness is not 100% for any method. And then, of course, typical use, because there's user error and we're all human. And so it's important to acknowledge that contraceptive failures occur, right? Yeah. So even when people are trying to do all the right things, sometimes their birth control doesn't protect them as hoped for.
So you gave a nice link I'm going to drop in here on contraceptive failure rates for perfect versus typical. So that will be helpful for those that were scrambling to write down numbers. Where can they look this up? That's a lot of numbers we just threw at our listeners.
Yes,
data. And then there's one more link about all sort of the other considerations and how to use them properly and stuff that I'll put in here as well.
There are lots of great resources from both Bedsider and Planned Parenthood and a couple of other organizations talking about the pros and cons, how different methods are used. A lot of them have little video clips of people talking about their experiences with particular methods. Super helpful information online that I always recommend people look at, read, watch. before they go meet with their healthcare provider, because then you're going to be really knowledgeable and you can focus on the things that are specific and unique to your situation.
Yeah. Let's wrap up this part of our discussion with just some comments on access and,
Right.
how to get your hands on these methods if you want.
Yes. So the only one I discussed that's over the counter that doesn't require a prescription or a clinic visit was condoms. So, all of our most highly effective methods require either a clinic visit or a prescription. So often your family doctor or a pediatrician or internist or OBGYN or your local reproductive health clinic, whether that be a county health department or Planned Parenthood, can provide you with many, if not all, of these options. They do need to be covered by insurance. So that's excellent if you have insurance. If you don't have insurance, county health departments and Planned Parenthood often have reduced or no fee services available. And then if you have difficulty getting to a location or you have difficulty accessing clinics, you can get online visits with providers and get birth control delivered to you by the mail. So there's lots of different ways. Bedsider is one of the online resources that has a lot of information on how to do that. So we're trying to make it easier for people to get good birth control.
Yeah. Okay. I'll put that in here. And we didn't talk at all about vasectomies, but we did actually have a recent post on that. So do you want to quickly touch on that?
Vasectomies are fabulous. So if you know that, you do not want to cause a pregnancy and you are done potentially, proliferating your genome, then vasectomies are a great way to go. It's an outpatient procedure. It's very low risk, and it's highly, highly effective, especially if you follow all of the instructions. So be really careful about the aftercare instructions on that. But again, just reminder that it's not meant to be reversible. It shouldn't be thought of as something that can be easily reversed because it often can't be. So vasectomy is a great choice for those who are done. There is research trying to figure out some reversible male methods of contraception, and there's lots of potential issues there. That's not the person at risk of getting pregnant usually. So they're willingness to put up with side effects or to be sure to do something every single day is going to be perhaps a bit lower, their motivation. The one that's closest to kind of making it to market in terms of that whole research pipeline is this system of these little plugs that they inject into the vas deferens, which is the tube that brings sperm from the testicles and the scrotum up into the body so it can be ejaculated out through the penis. So these little plugs that then there's a substance that then they can dissolve the plugs with later. So that's kind of exciting. It's still in clinical trials, so it's not ready for prime time yet, but might become an option in the near future.
That would be
hopefully.
great. So I'll just drop this post from Dr. Sarah Coles on vasectomy myths, so fact and fiction about vasectomies. But yeah, I feel like in my age group, a lot of my friends' partners are getting vasectomies. Seems to be quite popular.
That's a good one.
So let's move on. We talked a lot about Plan A. Let's talk about, Plan B, which actually is a name brand, I guess, but also just conceptually. So what are the different paths in this next bucket?
Yeah. So Plan A is things that you kind of plan for ahead of time, and Plan B is a oops kind of moment, right? So you've already potentially exposed yourself to pregnancy risk through either unprotected intercourse because you didn't use a Plan A method, or perhaps your Plan A method failed. You realized you forgot to take a bunch of your birth control pills, or the condom broke, or something like that happened. So Plan B, yeah, it is a brand name, but we're also repurposing it to refer to all forms of emergency contraception in general. And what I want to highlight here is that this is in fact contraception or birth control or preventing pregnancy. So these methods, be they pills or IUDs, are actually designed to prevent sperm and egg from coming together in the first place. So these are different than the abortion pill, and they often get confused, but they're actually two different things that work in two different ways. So when we talk about emergency contraception, we have kind of two main buckets. We have the pill forms. So the original Plan B that now has many, many generic versions of it out there, like E-Contra Easy and a whole bunch of other things, is sold over the counter. So you can get it at a pharmacy without a prescription. Sometimes they keep it behind the counter in a weird location because it tends to be pretty expensive and they want to kind of control it. But you do not need a prescription for it. You can also buy it on Amazon. You can be any age, any gender. I've had lots of boyfriends and male partners come in and buy emergency contraception for their partners. That's totally fine. So that pill form, and then there's a prescription pill form called Ella or Uloprostil. They both work by delaying ovulation. So ovulation is when the ovary releases an egg. So what they both do is that they slow that down. They say, no, ovary, don't let it out yet. There's sperm out there. Don't let it go. And so the ovary holds on to the egg for longer, hopefully then buying time for those sperm that are hanging out in the fallopian tubes to die off before that egg is then released. So, and we know this, we have actually really good evidence to support that that's how they are working, because we now have the ability to kind of measure and see what's happening inside people's bodies. And because we know that if you've already ovulated, these methods don't help. But it's hard to know if you've already ovulated or not. And what we see is that overall, the pill forms of emergency contraception decrease your risk of getting pregnant from an active unprotected intercourse by about 85%. Now, they are most effective if you take them right away, right? We don't want to let that horse out of the barn. We don't want to let that egg potentially get released from the ovary. And so the sooner you take it, even though it's called the morning after pill, don't wait till the morning. The sooner you take it, the better. And for that reason, we also recommend that you have these on hand. If you're somebody who is sexually active or may become sexually active in the near future, have this on hand in your sock drawer or your medicine cabinet so that if you ever need it, it's there in the moment. And then you don't have to kind of schlep out looking for a 24-hour pharmacy or something in your pajamas and Crocs in the middle of the night. So
I'm really glad you're clarifying this, because I was looking through our question box and there was a comment here that I assume I'm interpreting correctly here. And it said, no matter which side you're on, call it what it is. It's not emergency contraception. Yeah. I'm assuming this person assumes that these morning after pills are abortions.
Yeah, and they aren't, right? Which is really exciting, because then that means that this is an option for people who do have an ethical or religious, prohibition against anything that might interrupt a fertilized egg. So what we know is that, Plan B, for example, will do nothing to change the outcome once fertilization has already occurred. Certainly once a pregnancy has already been established, these medications do not interfere with that. So that's really important for people to know if those issues are central to parts of their faith or their philosophical beliefs. So it's nice to be able to offer that. So yeah.
I'm assuming someone's going to ask or is thinking right now, well, how do I know if I've already ovulated?
So it's really tricky. And so for that reason, and there's some great reasons, there are ways to do it. There are ways to find, but you have to have been tracking a lot of these things in advance to know, and you usually have to have very regular cycles. And so for that reason, it's not really practically possible for most people to say, well, gosh, have I ovulated already or not? So we recommend just go ahead and take the emergency contraception. Because again, if ovulation already occurred and fertilization has already occurred, it's not going to interrupt that with the over-the-counter morning after pill, or as soon as possible pill, really.
Yeah. So on access, how does that, we talked about this, over the counter, the lack of prescription, which is great, but what about, I've heard about pharmacists refusing to dispense these. So what's the situation there?
So that's an issue. So first of all, I want to say, in the wake of the Dobbs decision from the Supreme Court this summer that no longer makes abortion legal in the whole country, right? So now states can have laws that prohibit abortion. That does not impact emergency contraception. So first of all, Plan B is still available and can still be obtained legally in any state in this country. So that's really important for people to know. Plan B is not illegal. Ella is not illegal. Those things are still protected because they are not abortion. They are contraception. But it is important for people to know that they may encounter a pharmacist who refuses to sell them, even the over-the-counter Plan B or a prescription Ella, because it conflicts with their personal beliefs. Some states have legislation that says, no, that's not allowed. You're a pharmacist. You have to dispense anything that is prescribed or anything that you sell. You do not get to decide who can get it and who can't, or what medicines you dispense and what medicines you don't. But there are 7 states that have laws protecting, their kind of conscience rules that protect those pharmacists. So in Arkansas, Arizona, Georgia, Idaho, Illinois, Missouri, and South Dakota, legally, a pharmacist can refuse to sell you emergency contraception. So you might have to go to a different pharmacy or order online from Amazon. Right. So
And you don't worry about quality when you're ordering online from Amazon? How do you know?
No.
Yeah. Okay. I just want to give people more links to learn more. So I'll put one here from us and one from Planned Parenthood about emergency contraception. And
Great.
I can imagine there might be, a discussion in a couple where one member of the couple, believes it's an abortion pill and the other one. So I can imagine it would be nice to have resources at your fingertips to show somebody if you're having a discussion about that.
Absolutely.
Yeah.
And it's important for people to know. And I think that also kind of leads us into the other form of emergency contraception that's available, which is IUDs. So we talked about IUDs before as a method of, kind of proactive birth control, right? Getting it placed before you are sexually active. But IUDs can also be very, very highly effective as emergency contraception if placed within 5 days after the sexual activity occurs. So what we find is that both types of IUDs, the copper and the hormonal IUDs, actually interfere with the sperm's ability to swim and then fertilize the egg. So their primary mechanism of action, as we would call it, is to prevent fertilization. So most of the time when used for emergency contraception, they are preventing fertilization. They are preventing conception. I will note, however, that we know that with the copper IUD, it also, if the egg has already been fertilized, the copper IUD is toxic to a fertilized egg. So if that is important to someone because of their personal belief system, they should know about that in advance as well. So these are really, really highly effective methods of emergency contraception, with the bonus that then they provide ongoing birth control after that for, depending on the method, 5 to 10 or more years, which is great. But some people may have a religious or moral or ethical concern in regard to using this for emergency contraception.
Yeah. Okay, well, we have covered a lot today and we're just about out of time. So I just thought I would ask, since you have these kinds of discussions on such a regular basis, is there any kind of messages you want to highlight or something we missed that just comes up as a very common question?
I think we hit on most of the major misconceptions. I will tell people, one really important thing to remember is that if you use emergency contraceptive pills, they are only good at reducing your risk of pregnancy for sex that you had before you took them. They give you no proactive protection. And in fact, in the several days after taking them, if you have intercourse, your risk of pregnancy might be slightly higher because the ovary's been holding onto that egg and now it's ready to burst. So do not use them repeatedly. They're good for a one-off most of the time, but it's not going to protect you moving forward. So really important to remember that.
But you could use it in a month or something. I mean, it's more like,
absolutely. Yep.
Okay. And we don't have time to delve into the abortion conversation today, but is there maybe a top resource or two you want to mention for people that want to learn more about that topic?
Absolutely. So Planned Parenthood is kind of the premier organization in this country for all types of ways to not get pregnant and not be pregnant. So most of their services are actually helping people get birth control and reproductive health care. They do also provide abortion, and they have done a fabulous job with their website and online resources, providing a lot of detailed information about all forms of contraception, including emergency contraception, as well as the different methods of abortion that are available. And they can also help you know what the situation is in your state, since now it isn't a federally protected access issue. Depending on what state you're in, certain things are legal and certain things are not. So the folks at Planned Parenthood are really able to help you negotiate that. You can also find legal information from the Reproductive Helpline, which is the reprolegalhelpline.org. And there are also other resources for finding abortion providers if you need that at abortionprovider.org.
Okay. Well, thank you for taking the time to share your wealth of knowledge with our listeners and readers. Just a final word to wrap up here. If you have questions that you want for our reproductive health squad or for, COVID or other topics, since we're really branching out these days, please submit them to the Dear Pandemic website. And I also encourage you to sign up for our newsletter. I think it's twice a week, and you can get our latest post there, so you don't have to go looking around for them on social media. So, and last but not least, always seek the advice from your healthcare provider if you have questions about your medical condition. Thank you for joining us. Thank you, our listeners. That's it.
Thanks,
Goodbye.
everyone.
Be well.